Hello, everyone. Thank you for joining us as your week ends. We extend a very warm welcome to all of you. We will have more people joining us. And in the meantime, we begin without too much delay. Fireside Chats is a space to celebrate, showcase, and learn from the power of collective action for menstrual health and hygiene. We firmly believe that through collaborative advocacy, relentless pursuit of evidence-based solutions, and exchange of learnings and insights, we can catalyze a global movement that propels menstrual health and hygiene to the forefront of priorities. Fireside Chats is a collaborative initiative by the Global Menstrual Collective and the Menstrual Health Hub. This edition is about the relevance and power of evidence and the effort of MH networks in using data and evidence to further actions, advocacy, and government engagement. The spirit being learning and collaboration. Ritika, maybe we could move to the next slide. Yeah, thank you so much. So we have a few ground rules for us to consider. Please mute your microphones. Please keep your videos off. We would love to hear who has joined us. So please do introduce yourselves on chat. Please do put your questions for speakers on chat as we move forward with the discussion. And we will in the back end pick up these questions and make sure that we're able to pull those into the discussions. We promise that we will be sharing recordings and key takeaways within a week's time. So also do, for those who are missing this out, please do wait for the highlights. And without, I think we have enough people, and I'm gonna get started quickly on introductions. I'm Bhuvana, and I work with Uninhibited and the Menstrual Health Hub. I would like to introduce Arundati, who is associated with the Global Menstrual Collective and the Menstrual Health Alliance India. We are your hosts for the next hour, and it is truly a celebration to have you join us on this discussion. And we really hope that this sparks our curiosity and provides us with diverse perspectives from across the world. We're very thrilled to have speakers representing networks from various countries. I introduce you to Flávia Castelhano, who is the co-founder of the Coalition for Menstrual Dignity and researcher at Observatory for Menstrual Dignity in Brazil. Tanya Dargan, who is associated with the PAD Project, Reproductive Health Supplies Coalition, and is the co-founder of Menstrual Health Alliance India. Neville Okwaro, who is associated with AMREF, USAID, and the African Coalition of Menstrual Health. And we have Alhelí Calderón, representing Pandemic Periods Mexico, who is also the co-chair of Women in Global Health Mexico chapter. Arundati, I'll hand it over to you to kickstart the session.
Great, thanks so much, Bhuvana. And it's a real pleasure to have so many of you join us today. So again, a very good morning, good afternoon, good evening, depending on where in the world you're joining us. And a big thanks to Flávia, Tanya, Neville, and Alhelí for joining us today. So what we're going to start off today is with the first question that's getting into the meat of what we want to discuss. We do know that for menstrual health, SRHR, and for many other development issues, collective action does play a critical role in really pushing that needle. But we also know that evidence also plays a really important role in pushing the advocacy asked related to menstrual health and hygiene and so many other development issues. So what we want to hear from our four fabulous speakers today is that what was the pivot point? What was that critical juncture that made you focus on evidence, and evidence in different ways? It could be research, field voices, but what was that turning point for you to focus so deeply on evidence and collective action to push the menstrual health and hygiene agenda in your respective countries in the context in which you're working? So we're going to start off. So Flávia, we know that you've been spearheading this work in Brazil, and it's been particularly challenging given that you had a very conservative government in the past. So what was your pivot point that made you turn to evidence for collective action? Over to you, Flávia.
Thank you, Arundati. Good morning, good afternoon, good evening, everyone. So such a global panel, right? So thank you first for Global Menstrual Collective, Uninhibited, and Menstrual Health Hub for the invitation. It's a great pleasure being here. So I'm gonna highlight two special situations from Brazil that explain a little bit about our history, which is very recent. So this entire debate in Brazil started, the first law was a local law from 2021, no, sorry, 2019, and the national law it's from 2021 when it was approved, but just started to be implemented this year. So in 2021, UNFPA, the Population Fund, and UNICEF released an important report on menstrual health and management that found one of the data very important was that 700,000 girls in Brazil have no access to bathroom at home. At the same time, PEG, Procter & Gamble, also released a survey here in Brazil showing that 1 in 4 girls miss a wet school due to the lack of resource for menstrual management. So these numbers began to increase collective concern with support from political sides, right to left, except the extreme right, of course, because they was able to understand who is against school. If kids are missing school, this became to be a very important issue here in Brazil. So this movement to create data was important to strengthen the issue in the country and to help society understand the severity of the problem. So there are thousands of girls without bathroom, thousands of girls missing school because of this fact. And this started a very popular movement from civil society, even the people and the media and everything. The second situation, so this is the first one, a survey from international organizations and a survey from the private sector from PAG was good enough to start the debate. And the second situation is a little bit more personal, was during my research, my thesis, I realized that we don't have data in Brazil. And we know this lack has a negative impact on the production of public policies. I come from the public policy field. So how we are supposed to design a policy, implement something, if we don't know the scale of the problem, if we don't know the amount of people to be benefit, or even the investment needed. And based on this fact, we started to, at my university, Fundação Getúlio Vargas, we started a project called Observatory for Menstrual Dignity, to produce data, quantitative and qualitative data, to base the strategic policies and the debate in a global, in the national sense. So I think these two situations showed how data is important to act, to give more evidence to action.
That's great, Flavia. Flavia, do you just want to add just one point on how this actually also brought you to work with others for more kind of collective action, especially through the observatory? Just want to add a point on that.
Yes, with this reality, we started the organizations, the coalition now has more than 15 organizations. So due to this reality, we start to talk. We saw there were a lot of organizations working, but not together. So we started to talk and think that if we could have a movement, this could probably increase the voice. So we started to organize some collective movements to try to reach the national government. And we started to present ourselves as the coalition. So there are several organizations, UNICEF, UNPF, Plan International, academia, so many people working together to trying to help the debate here, because the government was in a very blind situation because they had no data and they were very far from the debate. So these groups were more involved daily, actually, and producing knowledge. So we came from this position. We have the information. We are in the field. We are fighting for this. So you should hear us and our suggestions to move forward with the law, to implement the law.
Great. Thank you so much, Flavia. I think it's really critical that, we do have several countries in the world that do not have enough data, enough insights on what's happening on menstrual health and hygiene, and how, bringing different groups together can begin to dig into that, give voice. You highlighted previously how indigenous populations in Brazil, we don't know much about their experiences. And by bringing different actors together, you've been able to give voice. Thanks, Flavia. And we'll circle back to you when we go into our question 2. Anyone has questions for Flavia and our other speakers, please do plop that into the chat box and we'll get to it. Tanya, we'd like to hear from you next. And you've been working in India and globally on the issue of menstrual products, informed choice, and very critically product standards. So again, here, what was your turning point? I mean, you've always known that product access, access models, quality standards have been important. But what was that pivot point that says, okay, here's when we need evidence, and we also need collective action, and we need to bring them together. So can you talk us through what happened with you?
Thank you. And thank you for posing this question, because as I was, reflecting on this, even to prepare for today, it actually took me back to how we started working on this issue. And it was useful to reflect on that for my personal purposes and how we should go forward in this as well. So it started basically in 2017, I think, when all of us, a few of us got together to form Menstrual Health Alliance India. The idea was to collectively identify and articulate the challenges in the MH space broadly, because at that point, as is today, there were a lot of organizations working in MH, but there wasn't a platform for collective voices that exists today, or even a cohesive narrative, so for that. So first, this space and this coming together of people, I think was the first point where we saw that we needed to bring in evidence to actually make any kind of asks in terms of policy change, in terms of investments or anything. So, and it's not that evidence did not exist, it was just scattered. So the idea was to bring it together in whatever form we could. So one of the topics at that point we zeroed in on was the menstrual product landscape. The others were awareness and menstrual waste management. But as we looked at the menstrual product landscape a little bit in detail, which was and still is evolving, we saw that there was and still to an extent is a singular focus on promotion of disposable sanitary pads. And this is where we started to look at the concept of informed choice in menstrual product access. And borrowing, from the family planning world, the concept of informed choice in menstrual health is something we felt was important, because it basically means that all people who menstruate should have access to a variety of affordable and good quality products, safe products for managing their menstruation as per their needs and preferences. So as we started to look at different aspects of informed choice, the issue of quality stood out by the absolute lack of quality standards for menstrual products globally. India had a standard for disposable sanitary pads, but it hadn't really been revised since the 80s, and no other product category had anything. So menstrual products, as we all know, external or internal, by the very nature of use, need quality standards if they are to be safe for users. In speaking with decision makers in government, particularly female champions, there was a realization that we need to collate more evidence to show these gaps and advocate for quality. And as we did this in India, the global conversation around standards also had started through the Reproductive Health Supplies Coalition, the Menstrual Health Supplies Work Stream. We also did a few exploratory webinars on product standards, which also again opened up the fact that we need to know more. We need to compile more evidence before we know what exactly we are asking for. So those were, I would say, a few pivot points.
Great, thanks, Tanya. And I think it's really striking that a starting point was also informed choice, that if we want to enable choice, we need to ensure access to products and access to quality products. And I think that's an important lens for us to look at or keep in mind as we're also working on product standards. Thanks for sharing that. Neville, now we're turning to you, Neville. You've been working in Kenya for a long time, and you've been looking and you've been deeply engaged with framing the policy for the Kenyan government on menstrual health. You've had some successes, but you've also faced some challenges. So again, for you, what was that turning point? How has evidence really helped in your journey, along with other collaborators, on framing that Kenyan national policy, and what made you come together to push and keep on pushing with your advocacy asks? Over to you.
Thank you so much. And thank you also for the opportunity to be here. Now for Kenya, we've had quite a progressive menstrual health campaign, even before we knew anything structured called menstrual health. By 2004, Kenya had already repealed matters of taxes on disposable pads, even though that never reflected on the cost. And even subsequent years, we've continued to look at matters of taxation on menstrual products. But what made the issue of policy come out so clearly and glaringly was when World Bank supported the Ministry of Health in developing the Kenya Environmental, Sanitation and Hygiene Policy. Sorry.
Can we ask all our participants to put yourself on mute, please? Thank you. Sorry, Neville.
The World Bank supported the Ministry of Health in Kenya in developing the Kenya Environmental, Sanitation and Hygiene Policy. By that particular time when we were developing the policy, there are just bits and pieces of MHM work that was being undertaken across the country. And most of this work was basically product driven, including what the government used to do, just going out to schools and distribute sanitary pads to learners. So at that particular time, we wanted to look at how can we have sustainable structures that we are able to anchor MHM programming on. So one of the recommendations that was made in that policy was for Kenya to have a standalone menstrual health and hygiene policy. So recommendation in the policy is one thing. Now it got to the point that we wanted to now clamor for that policy to be developed. The Ministry of Health, where the sanitation policy that recommended the development of a standalone menstrual health policy, never saw basically the need of that particular policy at that particular time, because according to them, there was no evidence that this is something worth getting into. As practitioners within that space, at that particular time, we had a very strong technical working group on hygiene promotion that basically looked at matters of hand washing and also issues of jigger management. So one of the things that we did was to look at how then can we ensure that the MHM voice comes out so strongly. So the government decided to form a committee and a task group within the hygiene promotion technical working group for the purposes of looking at matters of menstrual health and hygiene. And over the years, as time went by, we were able to furnish that data to the government, the data that menstrual health and hygiene is something worth getting into, and also to look at it's possible to have a structured way of undertaking menstrual health and hygiene programming. The greatest thing that I can say is without that collective action of private sector actors and NGO partners and others coming together, it will not have been possible for us to have the policy that was developed. Thank you.
Thanks, Neville. I think two things really struck me from what you were saying. One is that it has not been an easy journey. I think many of us in this room can understand that, but also interesting how you slowly and surely kind of positioned menstrual health, even if it was within other agendas, and use that time to collate evidence to make that case for menstrual health. So that's great. And I think your last point is also on the importance of bringing together this diversity of actors, civil society, private sector, as well as your government colleagues to be able to bring this in. And hopefully, when we move on to our second question, you can reflect and tell us a little more about how those relationships have been. Again, if anyone has any questions for Neville, for Flavia, and for Tanya, please put them in the chat box, and we will spend 5 minutes just getting to them. Our last speaker, Alhelí from Mexico, will not be able to join us because she's just had a baby, but she has sent in her audio recording of her response, which we will play for you. And if you have questions for her, her email is here, so you can reach out to her as well. So over to you, Ritika, to play her audio.
Hi, everyone. Thank you very much for the invitation. To answer this question, I want to mention a little bit about my background and how I started working with menstrual health and menstrual poverty. And well, I'm a researcher, also an activist, mainly on water sanitation and hygiene access, considering as a human right, and also reproductive rights, mainly the access to abortion. I believe in transdisciplinary work and intersections between fields. This is how I ended collaborating in these topics and start working with pandemic periods, which is an advocate group that aim to, originally we aim to increase the visibility of pandemic, the period poverty during the pandemic, but now we have been growing a lot in all different areas at political, academic, and advocacy levels in different contexts. I had the opportunity to facilitate a workshop for teenagers in Latin America from an abortion accompaniment group where I used to be part, and this is how I connect with pandemic periods, and I started being more active as an advocate in this topic in Mexico and in Latin America. And from this experience, I had the opportunity to collaborate and co-author different articles and chapters that make visible period poverty during the pandemic in different contexts, but particularly from Mexico. So I collect experiences from different part of Mexico, the north, center, and also indigenous community, where I learn and collect stories from girls and women, experiences related to period poverty during the COVID-19 pandemic. We know that during the pandemic, menstrual poverty was a very important topic that was commonly ignored by different governments. That happened in some of the geographies in Mexico, in particular states, and well, this is how I started working in this area. I have met and learned from incredible menstrual advocates from different geographies. I particularly amazed by Latin American collectives and organizations. We exchange experiences with them from Brazil, from Chile, from other countries. I realized advocacy advancements went one step ahead of academic production around menstrual health and poverty. There are several feminist groups that have been moving the agenda forward for the menstrual movement and other gender priorities, but the academia, particularly the academia, at least in Latin America and in Mexico, in this case, was falling behind. So to move political agendas forward to support the menstrual movement, we need data. in the last decade, we have been using available data from civil society and some available academic sources. However, in my opinion, and from my area of expertise, I believe that we must strengthen our knowledge production, particularly the academic one. Thank you.
Great. So, I mean, Alhelí has highlighted, I think, a critical point, which can also be a contentious one and relates to some of the questions we've got, is that in order to drive policy advocacy, we do need data, which none of us debate. But she's also emphasized the need for more rigorous academic research to be able to fuel that advocacy. And this goes back to a question that we've had Ina raise, and also one that I have related to that is how are we able to push that advocacy agenda by filling evidence gaps? And what's the kind of data research that we can engage in? Do we have to have hardcore, rigorous academic research? What's the role of perhaps field insights and implementation experiences that we have from a very large network of civil society organizations that may be present in our countries? So I want to throw this question open to Flavia, Tanya, and to Neville for any of you to answer. What's your take on the kind of evidence we need to be able to fuel this? Any of you can go.
I can.
Go
I
ahead.
can. So yeah, I agree that I think not extremely rigorous academic research is not always the answer, because sometimes issues are so focused, and we do have data available from a lot of community-based organizations that are working in the field. So maybe sort of changing the lens to look at what's happening in the field and documenting that both quantitatively and qualitatively is a good alternative. I think the research lens for policy advocacy should also be action-oriented. What is the minimum viable data required to influence change? And often, I think our investments get biased by what is the maximum possible rigor that can be achieved in research. And I think we need to find a good balance there to be effective.
Thanks, Tanya. Neville or Flavia, do you have any reflections on this before we move to question 2?
Yes, sure. I think here we had a very similar situation. And as someone from acting at the civil society and also in the academia, I think I was able to mix this situation. So the observatory we are creating here has exactly this intention: produce data to help the action, but to help not the action only from civil society, but the public policies. Of course, the government is the main responsible for this. So when we start study, when we start to produce a guideline, and we are very in the beginning with the observatory, but the main ideas are all around this, to produce data to support public policies. So this was the way we found to maybe deal with this gap, which is a factor here. And I deeply agree with my colleague from Mexico that in Latin America, the academia is very behind. So this was the way we found to overstep this situation. And especially in Brazil, we have a strong lack of different situations. For example, if bathroom, as I showed, girls have no bathroom at home, but even at school they don't have either. So this is the kind of challenge we are facing here, besides the lack of access to products and so on.
Thanks, Flavia. And I think actually this is, I mean, we're not going to be able to muddle through, this very important discussion on the types of evidence and what do we consider as evidence, and how can we support local research, local researchers, as well as civil society organizations to be able to, represent what they're learning from the field, because they do have those insights. So we're hoping that this actually sparks like a bigger discussion in our countries and at the global level on what we mean by evidence and how we can use that to further the action on menstrual health and hygiene. We do have some more questions on the chat box, so I encourage Flavia, Tanya, and Neville to look at that, and you can answer on the chat box, but we will circle back at the end of the webinar. But for now, I'm going to hand over to Bhuvana to take over from here. Over to you, Bhuvana.
Thank you, Arundati. Thank you so much for sharing all your perspectives on question 1. I think one of the key objectives of Fireside Chats is also to highlight the power of collective action. So that's social movements, that's networks, that's collectives. And very often, networks and collectives and coalitions, it's also a challenging effort, right? Like it's not a very like there is criticism that it's not tangible enough. Like, who are the members, who is putting in effort, yeah, I think, but at the end of it, it's a lot of like will and conscious effort that brings a network together to take forward any agenda. So we're super curious to understand, to sort of move, maybe actually like take a step back from question 1, zoom out a little bit and try and understand what your network's process and journey of generating evidence and building momentum among allies and members for the cause was. So what was the process like? What did you go through? What were the challenges? What were your big wins? Who were the stakeholders you engaged with? Who was your unexpected ally? So yeah, we're very curious to try and understand more about this. And Flavia, I will pass it on to you.
Thank you, Bhuvana. So yes, the topic here, Brazil, is took a slightly different path than other place because we were under a far-right government in 2021, which was the former President Bolsonaro. So the topic was still unknown here, but there were already bills being discussed at the Congress at that time. In 2021 was Bolsonaro vetoed the law that I am talking about all the time. So he vetoed the law, and the issue, because of this act, the issue gained public attention, a strong public attention and popular support. So even you ask the unexpected allies, even the congressmen and women from his political side voted against his position. So even his party was against his position. So it started a very collective movement and feeling, a popular feeling, like a national mood. We could feel this. So at the time, some organizations were already working with the congressmen and women to overturn his veto. And there was, for example, Girl Brazil, which is an organization that has in other countries too, but the girl from Brazil was one of the protagonists in this process in the country. In 2022, even with the law already approved, they didn't implement anything. And due to this situation, we decided to found the coalition because we saw we were not moving forward. So many organizations like Girl Brazil, UNPF, UNICEF, Plan International started to discuss what we could do to move forward with the agenda. And in May 2023, already under President Lula government, we requested hearings with the government. So we were in contact. We had meetings with the Ministry of Health, Ministry of Women, and other national members from National Congress to show our position. So as a group with 15 organizations, it was easier to have this space and to make the voice being heard. So we have prepared a guide based on data with the civil society with practical recommendations. It was something very practical. So we are talking about the implementation of the law. Here are some suggestions. what you need to take into consideration. The minorities, the vulnerable audience, good practice around the world, and the main challenge in the field here. So in the case of Brazil, the topic it's still, as I said before, little investigated in academia, but the civil society has the most active actions. It's more active in the field. So the action needs the civil society here. So after that, the government started to consider the coalition as a partner. They used to write to us. They used to consult us. They invite us to some spaces. And now we see we have a kind of relationship as a coalition with the government. It's still very in the beginning, but I believe it's something very consistent to start.
Thank you so much, Flavia, for sharing that. It's very interesting because in the way you started, it almost sounds like a revolution, you know, and it's truly remarkable to see the political recommendations for the law moving forward and the civil society playing such a huge role in this. And for you to be actually now included by the government and being taken seriously. So yeah, it's truly, for me personally, it's a very beautiful journey to hear from you, and I can only imagine what it would have been for you to witness it and to be part of it. Thanks a lot. I will now invite Tanya to share a little bit more on product standards and what her experience has been in that space with the network and with the multiple networks that you've been part of, organization that you've been part of. Very curious to hear from you.
Thanks, Bhuvana. And thanks, Flavia. It's really interesting to see how different but similar, I think, all our journeys have been in different aspects of menstrual health. So for us, I think in terms of product standards, the first piece or the first activity had to be just getting a seat at the table, because Bureau of Indian Standards, we weren't really sure of what the process was, how do you even initiate anything. So finding a champion in a ministry, in a central level ministry was the first step, and they recommended that our voice be heard and included in the BIS process. Interestingly, they had already started the process of revising the standard for disposable pads with I think it was a request from the larger manufacturers. But with the request of the champion from the erstwhile Ministry of Drinking Water and Sanitation, we were able to get a seat at the table. The next step was, how do we get some of these technical inputs? We are not microbiologists or material science experts. So how do we bring in the value that the committee needs from people that are participating there? And we don't have the resources of large manufacturers where they have a lab or they have experts who have these kinds of backgrounds. What we did have was our network. We have a bunch of SMEs who are part of our network. We had reusable pad manufacturers, disposable pad manufacturers, and we leaned on them to provide us these insights. And they were very, very generous with all of these insights, because they were not at that table, we were, and they, through us, provided those inputs. We spoke to people with expertise in microbiology, material sciences, compostability, labs who do testing, manufacturers across the board. We also did a lot of secondary research to find out what was out there. But I think the biggest stumbling block for us was that without dedicated funding, it was never really enough. We were always struggling. So I think there was, with the help of the RHSC, the Reproductive Health Suppliers Coalition, again, we got a pathway for this. We got a research and advocacy project funded specifically to gather evidence, gather data on what exists in terms of standards across different countries, what we can learn from different experts. And we use the opportunity to get some of these insights. These insights are now there for anybody to use for their advocacy in whichever country that you're working in. But we were able to use it for our India-based advocacy and now also for global advocacy with the ISO. these inputs were reflected in the revised standard for disposable pads, but also a new standard for reusable pads that India came out with, the first in South Asia, actually. It also allowed us to organize dissemination meetings with stakeholders because standards once created need to be complied with, but people always don't know how to comply with them. So it allowed us to have some of those conversations. So it's been a journey, and there have been many collaborators across this journey, and without every one of them being generous with their time, effort, resources, none of this would be possible. And none of this is a linear process. It's always, new evidence is coming up, and there's always back and forth. So that's the beauty of, I think, collective advocacy. It keeps going on.
Thanks a lot, Tanya. Thanks for sharing what you did about product standardization. Also, I think this is one of those areas where there is a very diverse set of technical stakeholders that come in, right? Like when you're looking at movements, and a lot of times when we talk about coalitions and movements and networks in the development sector, we also talk about reasons, but it was very interesting to hear from you that you were talking to product experts, manufacturers, and like bringing in technical expertise and social expertise, and relying so heavily on your networks. For me, I think that's sort of unique in a way with the area of work that you are in right now. So thank you for sharing that. I will now invite Neville to share his thoughts.
Thank you. Maybe just to pick up from where I'd left, here comes a case that the government that is supposed to develop the policy for menstrual health and hygiene goes back to the partners, that the only way we are able to develop the menstrual health and hygiene is if you give us evidence that this is something worth getting into. And at that particular time, I was actually the lead liaison of receiving whatever form of evidence that existed. And it's good that there are quite some studies that have been done, especially in Western Kenya, by various researchers. We gathered everything that had been done in Kenya, academic research, and also gathered whatever existed globally, furnished it with the Ministry of Health. And it was actually a game changer simply because looking at the academic studies that had been done and how they're able to push the agenda to a point that the ministry saw the need of now developing the policy. But apart from the academic research, there was a lot of work that was being undertaken at that particular time, even though it was piecemeal. Basically looking at different organizations, grassroots organizations going out there, apart from just distributing sanitary pads, but also looking at how do we pass information or on holistic menstrual health and hygiene. But even as that was happening, one of the most important things that maybe I need to point out, even though we have studies, dissemination of these studies is even more important than the studies themselves, simply because looking at the kind of experience we had convincing government on the need of getting into these, most of them never understood the rigors of research. And to a point that something that might be so simple to a researcher, like reporting that maybe 50% of people do not have 1, 2, 3, 4. To some people in government, it might actually be a challenge. And also coming with the p-values and correlations, that is something that is so complicated. So one of the things that I realize is keep it simple, let that study speak. But apart from that, apart from just the academic studies that we have, media plays a very critical role. The media at that particular time went out and gathered evidence and developed a documentary that really showed the extent of which poor menstrual management affects women and girls in Kenya. Even though it was rejected by some of the leadership, but it was a very strong voice that was able to rally the stakeholders towards ensuring that this is something that is going to happen. Lastly, what I can also say, even though it's important for us to look at the role that data and also evidence can play, it's also very critical to give voice to the voiceless. Hearing from those people that have been disproportionately affected by poor menstrual hygiene is something that is so powerful. We use that quite a lot, and it was able to actually change the needle. That without the help of media, without the help of civil society, without the help of um, uh, um, um, researchers, for sure we could not have made it. Right now, people know so much about menstrual health and hygiene in Kenya. To a point, simply because of some of the work that has been done by the grassroots organization, but also some of the work that has been done by media. Thank you.
Thanks a lot, Neville. I think those were some extremely valuable points around accessibility and dissemination of research, and how many a times that could be quite exclusive in terms of who is able to understand it, comprehend it, and use it. And of course, around the role of media and role of alternative media to also disseminate information and research and like gather people's voices. Thank you so much, Neville. I think those were extremely valuable points. What I will now quickly do is play Alhelí's audio recording for you all to hear, and we will move on to discussions post that.
Thank you for this question. Well, in pandemic periods, we began writing about menstrual poverty experiences from different countries.
Bhuvana, you're on mute. You'll have to unmute for us to hear the recording.
Let's talk in
I'm sorry. I'm going to replay this.
Social.
Just unmute, Bhuvana.
Well, in pandemic periods, we began writing about menstrual poverty experiences from different countries. However, we found opportunities that help us expand our scope in broader areas. We wrote academic and also non-academic articles, talk in webinars and panels, and led social media communication campaigns. This included response for particular social and political events at local, national, or global level, such as the Menstrual Health Day, the universal access to menstrual products in Scotland, and the elimination of taxes on menstrual products in Mexico. We grew up together as a group in areas of action, the number of volunteers, the regions that we represent, and the structure and the activities that we led in our group. This year, for example, we have our first Spanish-speaking webinar, Pintando de Rojo los Congresos, which means painting Congresses red. We invited civil society, international agencies, and policymakers to talk about the menstrual movement impact at political level in Latin America. This type of activities expanded our network in areas of discussion. For example, in the last decades, the menstrual health agenda had reached global level interest. This is thanks the hard work of activists, academics, and policymakers. But particularly, well, we know that menstrual health requires access to different different services and infrastructure, like education, inclusion, and policies free of discrimination, and different type of services. Civil society leadership, with the support of international agencies, had been established menstrual health and hygiene in the political agenda in several Latin American countries. In this region, we often find this movement as menstrual dignity initiative programs and policies. This type of regional discussion gives us the opportunity to exchange ideas about particular regions. In the Latin American case, we have addressed and questioned colonialism in three particular areas: how menstruation have been out of the public and political agenda preventing menstrual justice, how Western biomedical narrative have been the only one admitted and addressed menstrual health, denying indigenous and Afro-Latino and other epistemologies, and the gender perspective, in which menstruation means being cis feminine, refusing to recognize gender diversity in menstrual experiences and social power relations. So these kind of discussions are thanks to these spaces, these webinars, these volunteers exchange areas that we promote in pandemic periods. This is a good example of how Pandemic Period Collective, and I'm sure that similar process happened to other groups, open the conversation on particular priorities of menstrual movement in Latin America and in other regions. These between the volunteers first, and then with other organizations such as Menstruación Digna in Mexico, or interregional agencies, or other groups and NGOs that have been collaborating in different moments with our collective. Thank you.
The three speakers that we have here today, I request you all to share one aha moment or takeaway from one of your fellow panelists, briefly, and something that really did stand out for you, that provided some food for thought. And once we close this, we will also open it up for discussions. Yeah. Any one of you could go and go first and invite someone else from the group.
Okay, I can go first. So I think for me, the biggest aha takeaway from this is that all of us as individuals, I think, have been working on the specific issue that we've been working on for years, despite organizational affiliations, and have invested in developing relationships, networks, resources. And so I think the biggest takeaway is that a lot of this advocacy, collective effort, is a result of passion, a result of individual, collective passion coming together. And without that, it can't really lead to much change, because initially resources are always limited. It's like most of us have worked without funding in our initial years, but have still sort of powered through. So kudos to all of you for doing that. Flavia, sorry. Flavia.
Tanya, so yeah, I think I wouldn't speak one moment, but in a general way, everybody here is talking about the power of a collective action. So not a collective action in a country, but maybe in a region, or even in the whole world. So we are stronger together. We have a powered voice if we speak loud and together. And I think this is the for me, it's the main idea I take from this moment together. how we should amplify the voices and the talks and the actions. And also, I think another point that it's a particular touch me is because from Mexico, it's a very similar situation, how we are behind. So we are behind Kenya, we are behind India, and we are also a part of from the discussion. So it's the first time I see Brazil participating in a panel, in a debate. So this touched me personally because I believe that Latin America must be more involved. So Europe, India, Kenya should invite us, but we need to be to show up and try to be part of this. And well, I think that's pretty much what I would like to highlight. Neville.
Maybe for me, what is striking is you may think that it's only Kenya that has had a challenge on matters of menstrual health and hygiene and bring people together. But hearing Tanya speak, hearing Flavia speak, and also Alhelí speak, it's like these challenges cut across. And at the back of my mind, I ask myself then, is there why is it so challenging to champion for matters of menstrual health and hygiene, yet is just a natural biological process that menstruators go through? It's actually a big challenge just convincing not just governments, and in most cases, governments, most of them are led by men. It's so challenging just convincing them that this is something worth getting into, even as a social good. So even amidst the fact that we might speak in the long run, we go back to our grassroots, and back in the grassroots, people do not care whether you have a policy or not. People do not care whether you conducted studies or not. People do not care how beautiful you might package your work. The only thing they'll care about is how can we ensure that after using my menstrual pad, I'm able to dispose of it. In the first place, I'm going to have access to menstrual management materials, and I'm also going to have access to pragmatic information that is going to make me make informed choices. Yeah, I think it behooves all of us just for us to come together for the purposes of looking at that person that does not have a voice and will be a voice to that person. Thank you.
Thank you so much, Neville, Tanya, and Flavia, once again for being here and for making this happen. I invite Arundati to maybe like take over the discussion session, and then we can close off. I hope, I know we are very close to the closing time. I hope we're all able to stick around for another 5-10 minutes to be able to engage.
Thanks, Bhuvana. And again, thanks for these great points. As Bhuvana said, we're a little close to time. So I want to just, summarize some of the key takeaways, which I think hit me and reinforced, what we need to look at when we're looking at evidence and collective action to push the needle on menstrual health and hygiene. So some things that emerged from what Alhelí, Flavia, Neville, and Tanya spoke about is, one is we have different stakeholders who are engaging with evidence in so many different ways, and we need to create spaces for academics, CSOs, individual activists, community members to be able to come together and to present those evidence or to kind of share that evidence and create those spaces. A second point that really jumped at me is that we need to present these different kinds of evidence in compelling ways that will then push that advocacy needle and enable us to make those advocacy asks. And I think, Tanya, you raised an important point in the chat box that what are the different languages that we can use to be able to present that. So we often operate only within English or some predominant languages, but we also operate in countries where we need to ensure that the local language representation is there when we are gathering evidence and also disseminating it. The other, I think, key critical point that jumped out is that many countries get to a point of generating different types of evidence, but we also hold it very close. We are not generous enough in kind of disseminating it to all those groups who can benefit from it. And this we often direct it towards donors, towards policymakers, and towards other high-level organizations. But we also need to ensure that the flow of that evidence or those insights to organizations, especially those that are working at the grassroots level. Someone raised a really critical point on making sure that we're getting a seat at that table to present evidence, especially with those policymakers and decision makers. But we may also be representing the voices of those who are not at that table. But how do we ensure representation and carrying those voices of those who are not physically present in such forums, and ensure that the discussions that we're having in these important spaces are then carried back to those who have informed our thinking and our policy asks. A really critical point on liaising and making friendship with allies such as the media and others who can help present the case in compelling ways that we as civil society actors or as researchers may not do as well. I think, Odette, you raised an important point on, we do need evidence on what's the status of menstrual health and hygiene, but we also need evidence on what's working, why is it working, where is it working, and at the costs involved, and what do we mean by cost-effective interventions. So when we look at evidence, we also need to break it up and say that status, we need to understand what's happening, but also what are the interventions that are working and how and at what cost. And lastly, I want to end with the fact that we are, Flavia, it really hit me when you said that you're behind, and Alhelí has expressed this as well, that Latin American countries, Mexico is just behind in terms of evidence. And I think that you're very much on this journey, just as the rest of us are. And what we need to be doing at country levels, regional levels, at a global level, is to be able to create spaces for knowledge sharing, spaces where evidence comes together and we're able to share that more widely with communities and in different formats. It could be webinars, it could be knowledge hubs like the MH Hub, and regional gatherings as well. And how do we enable this kind of cross-learning and cross-pollination, that feeds into the evidence base and also helps with collective advocacy. So these are some of the points I think that has really emerged from this. I think we've covered many of the questions that have emerged, and I do see people are dropping off. So we're going to bring this webinar to a close. Really want to thank Flavia, Tanya, Neville, and Alhelí for joining us, and for all of you for being such a great audience. We're going to end by saying that, the Global Menstrual Collective and the MH Hub and Uninhibited have come together for these fireside chats. This is the second one, and we have 2 more coming, hopefully one in the next couple of months. So stay tuned for that. The MH Hub, as many of you know, is a global repository of research, of insights on menstrual health, of activists, of researchers that are working in this space globally. And they do have the menstrual memo that they send out every month. So if you haven't already, please sign up to that. The Global Menstrual Collective is a global advocacy body that's looking to push action on and investment in menstrual health and hygiene. We are on LinkedIn, so please do follow us for updates and for opportunities for engaging with the global movement. And with this, again, I'd like to thank all of you on behalf of MH Hub, Uninhibited, and the GMC for joining us today. And we look forward to seeing you again in the near future. Thanks, everyone, and have a good rest of the day.
Thank you. Thanks a lot.
Thank you.
Thank you.